welcome back to Ask the Doctor. I'm Mike Berger, here to answer your medical questions about vascular and endovascular surgery and wound care. Dr. John Sinkowski of the Arlington Vein Spa. Just call the number that you see on the screen. That's 1-877-593-7788, or you can email the doctor at jankowski@drjankowski.com. I think that's correct. Jason Sinkowski. I'll spit it out, John. We'll get this thing going. Tell me a little bit about what you do.
Well, I'm a board-certified vascular surgeon. As such, I take care of medical and surgical problems associated with arteries, veins, and as an offshoot of that, wound care. So arterial problems I would treat, carotid artery surgery, abdominal aneurysm repair, lower extremity bypass. Our vein surgeries are done either for cosmetic reasons in the office, or we take care of some severe vein problems in the surgery suite or in the hospital. Also do wound care as part of that. Many people with arterial and venous problems have wounds on their lower extremities. We do in the office a lot of wound care, and we can manage not only the treatment of the wound, but treatment of the underlying causes. And we also do the management, say, referrals to hyperbaric oxygen to plastic surgery, such as Dr. Reeves for coverage. So it's a very busy practice.
Oh, I guess so. Now, when it comes to wound care, the first thing I think of is the elderly. Is that the biggest area of wound care that you deal with, or does this run the gamut of all ages?
It does run the gamut of all ages. I will say that many of my patients are in the Medicare age group, about 65 or older, but young people can get particularly venous stasis ulcerations, which is a sequelae of very severe vein disease.
Okay, Dr. Sinkowski, let's get started with a phone call from Mary in Dallas. Mary, what is your question?
What causes varicose veins?
Good question. I bet most people can come up with a relative that had varicose veins.
I'm
a lot
sure.
of people tell us that their grandma had them, or maybe dad. Also, prolonged standing. I don't think our bodies are really built to stand up very well. So over time, the pressure in the veins in your legs gets severe, and you get varicose veins from that. But most of the time, a strong hereditary component. Occasionally, we see trauma and other causes, but that's what I see the most of.
Now, I noticed you said men and women, and the only people I really know about are women. Are more men getting it now because they have to stand more?
I think men have always had varicose veins, but men being what we are, won't go to the doctor unless it hurts real bad. Okay. So not necessarily for cosmetic reasons.
The phone lines are open. If you aren't able to get through, just keep trying, and we'll get to your phone call as soon as possible. That's 1-877-593-7788. And I think we have another question coming up here. I guess we're going to be right back, and then we'll have another question. Don't go away.
Can anything be done about these ugly blue veins behind my knees?
Can anything be done about the ugly blue veins?
Absolutely. Most likely those are going to be what they call reticular veins, and those are treated with injection. But I would say that they can be a sign of some underlying vein problems in the deeper veins in your leg. So what we normally do would have you come in for an evaluation. I do a full physical exam, we take a history, and we'll do an ultrasound evaluation of your veins.
What kind of vein problems are we talking about, Dr. Sinkowski?
Well, there's anything from spider veins or spider telangiectasias, which a lot of people have, to the larger veins that we just described, the blue veins that you can get, which are reticulars, to the bulging veins that you see in some folks called varicose veins.
Now, is that caused by a medical problem, an eating problem, a physical problem?
It's a combination of things. Mostly it's genetic, and what it comes down to is the valves in your veins, which allow blood to go up but not down the leg, are not working right. So blood pools in your leg, and as it pools, the veins get larger. The standing makes it worse. Trauma can make it worse. There's a lot of reasons to make it worse. A lot of people will get pain or blood clots in the veins if they become large enough. Some people get the ulcerations and skin changes. A lot of people just want them treated just for cosmetic reasons.
So when you take these out for cosmetic reasons, what does that do? I would think the circulation would be lessened. Is that true or not?
Actually, the circulation is improved. If you
Really?
remember, those veins are not working right. And what happens is when you take those out, the blood is actually shunted to the veins that are working correctly in the deeper part of your leg.
Do you ever see this in kids, or is there a problem in children that you run into that maybe our viewers would like to know about?
It's a very rare problem. There's a condition called Klippel-Trenaunay syndrome, in which your veins are not made right in your lower extremities. That's the most common thing that I see in kids, and they'll come in with pretty significant varicose veins starting at a very young age.
That's a shame. I'm so glad that you're able to do it and work with them and give them the natural childhood they deserve. We have another question from Caroline in Arlington. Caroline, what can we help you with? What are spider veins? I guess this is an email question. So we talked a little bit about spider veins.
Spider veins are the tiny little veins at the end of your big veins. So if you think of a tree, you have a trunk and branches and then leaves, and the spider veins would sort of represent the leaves. They appear to be of a little bit different etiology than varicose veins. They seem to be more hormonal, for instance. So more women do get spider veins than men.
Interesting. We have one more question from Robert in Garland. Robert? He would like to know how we should treat varicose veins. Well, I guess we should probably take them out, shouldn't we, John, if they're bothersome?
There are a number of different treatments, starting with non-invasive treatments like compression hose and just elevation, up to using laser and radiofrequency catheters to ablate or get rid of the veins. But again, that treatment is usually multi-part. We'll start with ablation and maybe work our way to injections. We start with hose, maybe work our way to injections. It all is based on a thorough evaluation and an ultrasound evaluation.
Very good. Thank you so much for being with us, Dr. Johnson-Kowski. And if you would like to learn more, all you have to do is call the number on your screen. That's 1-877-593-7788. Or you can go to the website. That's also on your screen. We'll be right back with Dr. Paul Marciano. Don't go away.